John Remillard, who is the president of Moses Ludington, joins us. Welcome. It's nice to see you. Do you see this project as a new model for smaller rural communities?
Absolutely. What we've been fortunate to create in Ticonderoga is very unique, and in partnership with the New York State Department of Health, we're creating a different model for rural medicine. The themes around this new model are outpatient care, emergency care, primary care, and care close to home. But it's new in that there's not regular hospital beds there anymore.
So that's the difference. That's the days of having the hospital beds there, having the operating rooms there. Those days have disappeared.
For this small rural community, yes, and the state's interested in it because community hospitals in rural New York State are struggling, and having all those services that hospitals traditionally have in many instances have become unsustainable for small communities.
Not having the hospital beds there, not having operating facilities there. The trade-off is you focus on having an emergency department that's open 24/7, because for people in Ticonderoga, they're a good 45 minutes to an hour away from the closest emergency room. So that was a priority to have 24/7 emergency care?
Absolutely. And in fact, part of this transformation was to rebuild the hospital with focusing on these elements that I just described. The centerpiece of this new construction has been a brand new emergency room. It's 4 times the size of the one that we've been operating out of the last 30 years. It's modern, it's bright, and we're really proud of it.
As you mentioned, the emergency room before, crowded quarters, oftentimes patients would be in hallways. There was really no place for family members to wait. This is a huge improvement.
Right, there's a great deal of privacy for the patient. There's room for the patient's family. There's room for the caregivers. It's a really bright and modern space, and it does have a component that's very unique that we're quite excited about. As I mentioned a few moments ago, we don't have any regular licensed hospital beds with this new model, but a part of our new emergency room are 4 private rooms. They're called observation beds. So if a patient comes to our emergency room and they may need care that can be provided in a 1 or 2 day stay, and for certain diagnoses where it makes sense for them to stay in Ticonderoga and be in one of these beds, we'll be able to accommodate that. So that's a new an exciting component for us.
And along with quadrupling the size of the emergency department, you're also adding radiology, laboratories, so you can do your own testing there, outpatient services. What type of outpatient services will you be providing?
We're going to be performing some brand new services for the first time in Ticonderoga in quite some time. First, there's going to be a new chemotherapy unit. So people that have cancer and now have to travel far for their chemotherapy will be able to get it right there in Ticonderoga. And that's also only made possible because of our relationship with the physicians in Burlington and Plattsburgh. We're also going to be starting an endoscopy program, so people don't have to travel to get their colonoscopies like they do now. And then in addition, we have specialty clinics, and what that means is, for instance, an orthopedic surgeon or a cardiologist or a plastic surgeon, they will visit and, at a certain interval, maybe twice a month or once a month or once a week, and see the patients in the local community, so they don't have to travel again for those specialty services. So that's all part of the idea of bringing care as close as possible to the patient. In addition to the new hospital services, we're working very closely with Hudson Headwaters, and we're going to be building new primary care space at the hospital so that they can be right there close to the hospital services, so we'll have primary care on the campus. And we also have senior housing on our campus in Ticonderoga. So we'll have senior housing, nursing home, primary care, and this new model of a hospital all in one spot for the people in the region.
And as time goes on, you mentioned Hudson Headwaters right now is in Ticonderoga, but is looking to locate on campus within the next couple of years.
That's correct.
And have primary care physicians there
Yes.
right on the campus. Down the road, do you see other services coming into this medical village, whether it be dental, whether it be substance abuse treatment? Do you see other types of healthcare services eventually coming to the campus as well?
Yes, that's part of our future thinking. In fact, we're in conversations with a dental practice to establish a practice on our campus. That's pretty far along, so I'm hopeful within the next year we'll see a dental program there. And we're also talking with St. Joe's out of Saranac Lake, who does work in the area of substance abuse, and we're looking to see what services we could partner with them or have them co-locate on our campus.
Is this really the first hospital to have this many services all together in this medical village?
For this new concept of a medical village, as it's been now discussed over the last couple of years in New York State, I think we are the first. The head of the health department in Albany, who's been up and watched this project and was actually at our open house a couple of weeks ago, he's often described what we're doing there as a new model for rural New York State medicine. So he's watching it closely, guiding us, and he's told me he hopes it can be replicated in other communities.
What are the benefits of having the partnership both with Elizabethtown Community Hospital, CVPH, and Burlington, UVM?
Medicine has become complex over the last couple of decades. It's changing, it's growing, and for a small community, isolated hospital to keep up, stay current, is almost impossible. But we can now make those assurances to our local community that it is the latest and the best because of our relationship with CVPH, University of Vermont Health Network, because we're connected with all those highly trained physicians. That's really, to me, the biggest benefit.
Hudson Headwaters, you mentioned, is hoping to open a primary care facility there. They have opened a number of clinics and healthcare centers around the Adirondacks, 17, I think, in all, one just about a year ago up in Champlain, a sprawling campus up there. In fact, the ground just broke this past week here in Plattsburgh over at CVPH at the Diagnostic Center, Hannaford Plaza, for a primary care facility there. Are those a critical part of healthcare for the future in the Adirondacks and rural communities like this?
Yes. For a health network to be successful, it needs a very solid and strong primary care base. And Hudson Headwaters are experts in providing primary care. They've done it for a long time throughout the Adirondacks. And they have formed a partnership with the University of Vermont Health Network. And that's why you see all these collaborative efforts like you just described in Plattsburgh and the one that we're going to be embarking upon in Ticonderoga.
The thought is having them in these smaller communities closer to where people are makes it more likely that they're going to go get medical care.
You know, the thinking is that the adjacency of having Hudson Headwaters attached, if you will, to our new hospital model in Ticonderoga will be really good for patient care. So when you go visit the doctor in the office and the doctor says, oh, you need to have an x-ray or you should have a lab test or you should get some physical therapy, it'll all be right there. It's just go across the hall or up the stairs or take the elevator and there you are. So it's integrated care, and I think that's better care.
And for patients, if they see a doctor earlier and they get the care they need, one-stop shopping under one roof, oftentimes it can take care of conditions that would otherwise they might end up in an emergency room months or years down the line. And that's where the price of healthcare soars, is when patients who haven't been to a clinic, haven't seen a primary care physician, end up in the emergency room with chronic illnesses.
That's correct. A solid primary care program improves the person's health, improves the health of the community, because you get early access, you get those testing, and if you're going to have a disease, you catch it earlier and you can get it treated. So there's a lot of benefits to it, and that's what we're trying to accomplish. With all the challenges of the new healthcare system and resources shrinking, if we weren't able to do this project, a lot of healthcare would just disappear from Ticonderoga. So by being able to preserve it for that community, it's very rewarding.
So John Remillard, thank you very much for taking the time to be with us. We appreciate you coming by.
My pleasure. Thank you.